Kathy Matt, and it is my honor to serve as the Dean of the College of Health Sciences. And I just want to take a few moments to welcome you this morning to Star Campus and also to the program today, where we are going to be working and looking at how we improve healthcare delivery. So we will we'll be focusing on today quality improvement and also performance management. As I was looking over the schedule for today, thinking about, that's something that we can all really use, right? And in order to sort of put ourselves in the mood, one of the things that we like to use at the university is actually something called healthcare theater. So we know that probably all of your practices and everything are operating at the top of their level. And but we thought it might be helpful for today's discussion, and I see a few smiles. We thought it might be helpful for today's discussions for you to just have a moment to put yourselves into a management meeting that maybe doesn't go quite so right. And so with that, I'm going to turn it over to our simulation.
Sorry, excuse me. Sorry I'm late.
Good morning, all. Thanks for coming to our monthly staff meeting. We have lots to talk about, so let's get started. First, our revenues. As you know, we have a benchmark of filling 85% of our available appointments. Thanks to the recent outbreak of the flu, we were 92% full last month. But we need to come up with some other ideas. I'm thinking we'll have the MAs start making reminder calls for the Welcome to Medicare appointments to try and keep the schedule full and be sure that we're staying connected with our patients.
Can't wait to see how that goes over. Stacy and Kevin haven't had a minute to spare lately. They've been so busy trying to keep up with this new depression and contraception assessment tools that the doctors have them doing when they room patients. Good thing they're not here to hear this. They'd flip.
If I've said it once, I've said it 100 times. We need to do the coding training for our providers. Of course our revenues aren't great. We're not even billing for everything that we're doing.
On a different note, I'm sorry to report that our patient satisfaction scores are down quite a bit. Last year, this time, 85% of patients rated this practice as excellent. This year, only 70% of patients rated us as excellent. 15% in a year is a big drop. To get us started, I've made a quick list of things for each person to try and do over the coming month.
Rebecca, I actually had some thoughts on this. I really think the issue is wait times more than anything else. So maybe if I plan some calls ahead of time, then patients wouldn't have to come into the office. And then the providers...
Yep, that's definitely something to think about. Let's keep thinking about wait times. But I had a few other things I wanted to mention. First, the front desk. Let's set a maximum of 3 rings before answering the phone. You know how people hate being stuck on the phone.
Yeah, sure. Like we're sitting around shopping on Amazon, letting the phones ring and ring and ring. 3 rings? Should I cut off the patient that I'm talking to at the window, or should I cut off the patient I'm on the other phone line with? Okay.
Next, specific to the providers in this practice. We've been hearing complaints about the cost of meds from several patients. Please remember that different health plans have formularies, and you need to check those before prescribing medications to help the patient save money.
Lord, protect me from administrators trying to play doctor. She actually expects us to manually look up each medication one by one and then compare it to see if it matches the lowest level tier on the patient's formulary. We asked for an EMR to do this a month ago, and she said, no, it costs too much. I mean, we could save the cost of the new software in time spent alone in the first few months. Yeah, great.
nursing, if you could work on getting the patients all the information on our patient portal so they could contact us electronically, I think that'll help too. Let's aim for 65% enrollment on the portal for our active patients.
Okay. This is not a nursing-only responsibility. Is the front desk even giving the patients information about the new portal anymore? I can talk to patients till I'm blue in the face, but our older patients are not interested in logging in. They just want to call into the office. Oh, goodness, I could tell her this, but, she'd just forget by the next meeting. I do hope this meeting wraps up soon. I have to get Mrs. Smith her lab results before she leaves for work. Yeah, that sounds good.
So I'd like somebody to take the lead on this to help get things rolling. Okay, then. I'll put that on my list, I guess. Why does nobody care about this stuff but me? Every single person should care about our patient satisfaction results. I feel like I'm all by myself in this quality improvement work.
If we saved everyone these useless 2 hours every month, that'd be what? $6 grand saved in people time every year? Does she realize how expensive it is to have 6 people sit around and spin their wheels with no result?
And that is a snapshot of a maybe slightly dysfunctional meeting. A round of applause for our performers. Before we leave, I'd just like to have each one of the performers introduce themselves and just give a snapshot of what else they might do here in their day job.
Hi, my name is Christina. I'm a student. I'm a senior political communications major and a theater minor.
Hi, I'm Jill. I'm a senior chemistry major.
Kathy Conrad, I'm an administrative specialist over in the College of Agriculture.
I am Zach Jackson. I'm a PhD candidate in political science and a professor for the theater department and an academic advisor for the School of Nursing.
So he's not busy at all. I'm Frank Newton. I'm Associate Dean here in the College of Health Sciences, so for Administration and Operations.
And my name is Alan Carlson, and I teach in the theater department. I'm also the co-founder of Healthcare Theater, and the other co-founder and whose idea Healthcare Theater was back in 2009 is Miss Amy Copperthwaite. Miss Amy Copperthwaite, do you want to say what you do? I mean, I know, but I...
Busy person as well. I started in the Simulation Resource Center in 2006, started working with Healthcare Theater, and Alan came with the students and did just send them, which was amazing, in 2009. And we built this program for the last 10 years and really gotten a lot of really good response from it, both within the university and outside the university. It just gives you the obvious, and I wasn't any part of the script writing for this, but I thought it was so applicable, and it was a really great representation of what can happen in dysfunctional meetings. Maybe not all 6 of them would be dysfunctional, but and I have then since started working with the engineering department to build wearable technology that we created to actually put on live people to allow them to do simulation and be sicker. So if you think of like a trained patient or something like that, and we can put this wearable technology on them and allow them to respond in real time with the sensors that are embedded in it. They can actually suction out real mucus and things along those lines. Great breakfast thoughts.
So on behalf of Healthcare Theater, we'd like to thank you for the opportunity from our good dean who allows us to do this, and particularly for Sarah and Nicole, who you'll be with for the rest of the day. We might see you a little bit later on this afternoon, and we're going to be leaving. Thank you very much.
So I too want to just thank Healthcare Theater for doing that, and we'd like to use these simulations. Again, I heard a few chuckles and saw a few smiles and everything, so I think you can probably relate to some of those challenges. And then, so what I want to do is just take a few moments, and I think Sarah's going to come up as well to sort of debrief a little bit about what we just saw in kind of the dysfunctional meeting. But before I do that, I just really want to thank you very much for coming this morning and for today and for really engaging in this workforce curriculum and the retraining program. We realize very much that you are all busy in your practices and that you have a lot of things coming down the pike with changes and everything that need to happen. And some of that you heard represented in the meeting this morning, from billing to working with patients to patient portals to figuring out codes to figuring out how you do comprehensive care that's really focused on the patient when you only have, 5 or 10 or 15 minutes, and you've got to really capture all of that. And the challenges that they bring to you are not just medical. They're actually much more comprehensive than that. So then how do you really get to solutions that are really going to help your patients and help you feel like as well you can function at the highest level of efficiency? So as we were doing healthcare transformation in the state, I actually played a role in the workforce committee. And when I co-chaired it with Bettina, one of the things that we heard over and over again is the part about practicing at the top of your license. And one of the things that I'm really impressed about in Delaware is really the amazing healthcare workforce that we have very, very talented people, but sometimes the challenges of your day really get in the way of you being able to really practice at the top of your license and practice and do all the things that you want to do because you're actually strapped with these other things. And so that's really what this curriculum is about. I think another important point about this curriculum is that some of it, as you know probably already because you've engaged, is online, but also a lot of it is about coming together on these in-person sessions that will be done throughout the state. So that we can really, to some extent, come to you, and we really appreciate that we have people from all different counties, and it is all about Delaware and the whole state, and so we really want to be able to do that reach. So we really appreciate that you're all here because I think in addition to the experts that we have, so we're really happy to have Nicole Diener from Health Teamworks, who's been really doing practice transformation already in the state and really now is partnering with us on this curriculum piece. But it's also wonderful to have you all here present because then we can also share lessons learned and what does one practice do and what does another practice do by solving these issues, because there will be commonalities in the challenges that you have. And some of those you saw expressed today. So you have a schedule in front of you for today's session, and Nicole will be leading a lot of the parts of that, and we'll be going back and forth. Another thing that I wanted to highlight, and you heard a little bit about that, you saw Healthcare Theater, you heard Amy speak and also heard her speak about the new company she started, SimuCare. All of these things are innovations that have really grown out of, to some extent, us being here on the STAR campus, the Science, Technology, and Advanced Research campus. So I also want to tell you later today, if some of you have time, at the end of the day, we will be happy to do tours and sort of show you some of the labs, show you what our clinics are. We have a physical therapy clinic, a primary care clinic that's run by our nurse practitioners, and then we also have a speech clinic. And then we have the research labs that go hand in hand. So when you talk about translating the latest in research to really cutting-edge clinical care, we've got those connections. They're right across the hallway from each other. And then we have undergraduates all the way up to graduate students, all the way up to healthcare professionals and clinical professionals, all working together in an environment. Today, at the end of the building, we have young high school students from Independence High School who are coming in because we're trying to encourage them. We need you to be part of the pipeline to come into healthcare and be part of the workforce that we're growing. So I think with that, I'm going to turn it over to Sarah, who's been doing the lion's share of this work from the UD side, really putting together this amazing curriculum. She and Nicole have really spearheaded this and really done an amazing job along with a lot of our faculty at UD. So Sarah.
Thank you. Well, thank you very much.